In a 3 by 3 meters plastic tent, Dr. Najdat Saqr has his dental practice making do with very few tools and equipment. Before the war, Saqr had a thriving dental clinic, which has since been destroyed by Israeli bombing.
Over
the past 6 months of this war, the area where I live was subjected to many bombings and destroyed my clinic there. I searched among the rubble for any equipment or devices that I could use again. Then I set up this medical tent. I still face many obstacles due to the lack of the necessary tools and other materials, which are very difficult to find.
The war has had a devastating impact on Gaza's healthcare. Many sections in the Abu Yusuf al-Najjar hospital, which is now serving more than 1.5 million people in Rafah, have closed, including the children's unit, due to the lack of medical equipment and supplies.
Our
shortage goes beyond the lack of medical devices. The hospital did not have enough capacity to treat the residents of Rafah, but today we are forced to serve more than 1.5 million refugees. We don't have the most basic capabilities. Even the simplest tests are not available.
Samah Fatin came to the hospital with her 32-year-old son Muhammad, who was injured in an Israeli airstrike in eastern Rafah. Despite his extensive injuries, Muhammad has been laying on the hospital floor for hours.
We've been sitting on the floor for 2 hours now with my son in my lap. I took off my clothes to cover him because I can't find anything here in the hospital to cover him. Healthcare does not exist here anymore. The little girl is holding the saline bag because there's no place to hang it.
According to the Palestinian Health Ministry, 32 hospitals in the coastal enclave have completely shut down, including the Al-Shifa and the Al-Nasser hospitals, which were Gaza's main medical providers, leaving more than 2.3 million Palestinians with very few options to get medical treatment. Nur Harazin, CGTN, Gaza.